Chemoembolization and radioembolization are two targeted liver therapies that we offer in interventional radiology. So systemic chemotherapy goes in the veins and goes everywhere to the body, including the liver, but also other sites. But the doses are relatively low because you have to deal with systemic side effects and toxicities. With chemoembolization and radioembolization, these are very targeted, intense, liver-directed therapies where we can give extremely high therapeutic doses of either chemotherapy or radiation therapy specifically to liver tumors. Tumors in the liver are fed exclusively by the hepatic artery, and therefore we can get into these arteries and target the tumors themselves by injecting tiny little particles coated with either radiation therapy or radioembolization or chemotherapy, chemoembolization, directly into the tumors to give very intense localized therapy with very good results. So this is essentially a relatively new therapy that's gaining wide popularity in treatment. The experience and data are mounting. A very good chance that this is going to be a first-line therapy for people who present with metastatic disease within the next 2 years or so. But even before that or independent of that, we're treating many, many people who are just not responding that well to chemotherapy or who are not resection candidates surgically. Anybody who has liver tumors and who has what we call liver-dominant disease is a very good candidate. So essentially, liver-dominant disease is somebody who's may have some tumors outside the body, but the most of the significant tumor is inside the liver, or the most imminent threat to their health and well-being are liver tumors. The patients who just have liver disease, which is extremely common, colon cancer, breast cancer, pancreatic cancer, a lot of times just present with liver tumors and that's it, are also very, very good candidates. So really anybody with liver metastases or primary liver tumors are candidates for this therapy. So everything, all the conventional therapies have been thrown at the patients. Their tumors are growing, they're not responding. There's really no other option. And even in tumors that are that difficult to treat, that aggressive biologically, our response rates are fantastic. We have such an arsenal of tools and abilities to treat these tumors that regardless of how aggressive the tumor is, regardless of how many tumors there are, we usually have excellent results. Because what we can do is just offer a multi-pronged assault on liver tumors. And we work in conjunction with medical oncology, and we're able to give these treatments simultaneously. And they are not mutually exclusive, they're actually synergistic and additive. So we can see these patients at any time after their diagnosis through their course of chemotherapy. We have the uniqueness in that I'm the only interventional radiology authorized user around, and that's anywhere in the Tampa area within 100 miles. And what that does for us is it gives us the distinct advantage to be able to run a full liver tumor clinic where we see the patients from initial consultation through the entire procedure, completely manage and arrange follow-up, take very strict control and follow-up of the patients, whereas every other center in the area, the authorized user is another specialty, either radiation oncology or nuclear medicine, and it's a very sort of disjoint process for the patient. With us here, it's a very seamless referral process. We see the patients right after consult. We essentially can see any patient within a week of referral, have the procedure set up, ready to go within 2 to 3 weeks, and be able to follow that through all the way. And that's just not something other places can offer that don't have an interventional radiology authorized user. The majority of our referrals come from medical oncology. Occasionally we get them from surgeons. Surgeons will often see a patient for possible liver resection for surgical removal of tumors and can't do it anatomically. That's another place we can come in is we can get to every liver tumor in any location and treat them. One of the best things that we offer at St. Joseph's Hospitals is a team approach to the patient. Everybody kind of puts their heads together, figures out the best course of action. All of our physicians are very close personally and professionally, communicate with each other. We always know what's going on with our patients. We always take care of each other's patients as if they were our family. And it's just a wonderful environment to be in, to be able to have that approach, put the patient right at the pinnacle, right at the center, and just obtain amazing benefits and outcomes for patient response using a team treatment approach like this, especially in interventional radiology around, and strongly encourage people to get on the website and see our background, compare it to some of the other interventional radiologists in the area, and they'll see that there's really no comparison with the physicians here at St. Joseph's.